Hello, everyone. I think we are live, and I'm so glad that I'm here today because about a couple of weeks ago, Alicia, who is here, welcome, Alicia.
Hello, and happy holidays, just around the corner.
Happy holidays. I hope you're all well. A couple of weeks ago, we were thinking, there are so many people who are asking for help and have questions, and I'm always trying to figure out how to come up with the best possible ways of helping as many people and many dogs as possible. So we thought, okay, why don't we just do a question and answer session, and we'll do it before Christmas, because I don't really like New Year's resolutions and starts it on January 1st, then it usually fizzles out. So this is much better because we're starting before Christmas when it's relatively busy, but obviously you're here because you love to help your dog and you love your dog. I had multiple cuddles this morning with Pax, and I know how you feel. I know how you feel about your dog, how difficult it is sometimes to find the right answers, because I don't necessarily look for answers in veterinary medicine, but I look for answers in other fields like, I don't know, plumbing and electrician work or gardening. And it's super hard to find the right advice. So this morning, I've looked at all the different submissions, and we have been able to invite some people on just to make sure that there is a little bit of a flow in the hour that we have ahead. And I'm so happy that I can help at least some of you. And those of you who are not going to get on camera, you will get the answers from our customer service team and myself, and we'll send you as much information as we can to solve some of the challenges. This also has given me an opportunity to see what needs to be done, what I need to write on and create materials on, which makes me super happy because I love to be motivated and fired up, and he definitely helped me that. From what I've seen this morning, I see that medicine is in the same kind of crisis as our environmental situation on this planet. I can see that practitioners are trying to help, but they're using more and more stronger drugs and more suppressive drugs. They're working against the body, against the signaling and healing system of the body. So that kind of worries me. And my goal is to kind of give you a little bit of guidance, but also explain why I do not recommend certain drugs and how they affect the body. We will have about 4 to 8 dogs and their people here today. I'm going to help you learn the same principles that I use for Pax and I when it comes to maintaining our health. And I'm pushing close to 60 now, so it's I'm kind of feeling that there's the pressure is on, but so far so good. And I definitely have not resorted to chemicals and processed food in creating health. Alicia will help us here and navigate through the whole maze of people who are waiting in the waiting room, and we will start. So, Alicia, I'm not sure how many people are in the room.
So far we have over 40 people in the waiting room. So thank you to the community for joining us. And I can definitely admit our first dog lover in. Marion has a dog named Dana, who I understand is a mixed border collie. So we'll see if we can let Marion in and start off with speaking about your amazing dog, Dana.
I got it here. I have Marianne. I see her in the registration form, so it's all good. Let's try to get her on.
Excellent. Hi, Marianne. Can you hear us and see us okay?
I think Marianne is muted, but we are going to unmute her. Marianne, just press on the mute button. That's great. Perfect.
Thank you.
Hi. How are you doing?
Hi. Oh, pretty good. How are you?
Really nice to see you. What's your dog's name?
Dana.
Dana. Yes, absolutely. So if it's okay, I'm just going to read what you wrote here, and then we'll have a little conversation. I'll make a few comments because we have quite a few people lined up, and Dana is
Sure.
speaking, I can tell.
Sure. Yeah, I bet.
Where are you located?
I'm in Woodstock, Ontario.
Oh, nice, nice.
I did live in Vancouver. I did live in Vancouver for about 40 years, but I came back to take care of my mother. So
Came back home. Yeah.
yes, yeah.
So-
It's not like Vancouver though. But anyway, yeah.
So you have a question about Herky test, and for everyone else, Herky test is a very efficient, highly accurate, and simple and inexpensive analysis of dogs' hair. And even I can sometimes analyze my hair, even though I have to take some time to collect it. Dana got her hair analysis, and Marianne is asking, you have some questions, Marianne, about hypothyroidism, right? That the panel came up with potential hypothyroidism or thyroid challenge of some sort.
Yes, although I did listen to your seminar on the thyroid, and that was really clear. But I don't get the connection between the metabolism, especially if the PAT is balanced. Her metabolism is still low, so I'm just not quite sure what to do about that.
Yeah. How old is she? How old is Dana?
She's 7. She's 7 and an intact female. Yeah.
Okay. I'm going to show everyone a little sample of hair analysis just to give everyone a little bit of an insight. We've called this hair analysis Herky test because it's like hair IQ. And, this is not Dana's test results. This is another patient's results. I whitened it out. So these are the minerals here that are measured, and these are heavy metals on the right side. Now, the minerals should ideally be in the white and light gray area. And you can see this is a little bit of a roller coaster here. Not everything will be in the middle of the normal range. It's impossible, but you can kind of look at this dog and see that there's a little bit of excesses, some kind of deficiencies. We have also really high mercury here. But what Dana is asking about is actually this kind of analysis. Dana, this is what you're asking about, right? And
right.
Sorry, Marianne, I'm calling you Dana. There you go.
That's okay.
But I'm sure you take it as a compliment if I call you.
Sure, yeah. For sure.
Anyway, Marianne, so it is my understanding that Dana's level is right in the low area, right?
It's between low and ideal, but
Okay.
they're balanced. Everything is balanced.
Everything is balanced. So
Yeah.
So if it's between low, so just to kind of give you a little bit of a summary of all this. This is more of an algorithm-derived result when it comes to the endocrine index. It is not a final definite test to measure whether Dana has thyroid problems or not. The most important part is that everything should be ideally balanced, right? Like if things are close together, the pituitary thyroid adrenal axis, then it actually means that Dana's metabolism is pretty good. If it was really all on the low side, then we would be looking at maybe boosting her metabolism or looking at some other ways of sprucing up her body. But if she's between low and ideal, it is not as important as the fact that she's balanced. Okay,
Right.
And you can even read it in the results. So if anyone else gets test results and you see that things are pretty good and there's a good balance, and they're on a little bit of lower side, that is not as important. You can definitely go to your vet's office and submit a test for hypothyroidism.
Okay.
And then you'll see whether there are any concerns to be had. But I would not expect that from what you're describing.
Okay. So I know you've got lots of people, but to increase the dog's metabolism, is it just the diet? And exercise, obviously. But
it is not an easy question to answer, but I'm glad you answered it. So there's several different things. Like I'm just gonna say that in her case, I think that she's really good. If the levels are at the same, if the pituitary thyroid and adrenal axis are at the same level, I would not really worry about it. And it even mentions it in the description here. But if anyone has a dog with relatively sluggish metabolism, and I kind of suspect that it's not Dana, there are a few steps that you take. You detox your dog regularly, you feed it the right homemade or raw or cooked diet. You provide the essential supplements. I use the Fabulous 4 packs, and some of our community members do too. Then there is another kind of level. You can go into spinal alignment, which is the energy flow for the body, and it's super important. And then the next one, and this is something that we're just kind of barely scratching now, is mitochondrial energy booster for middle-aged and older dogs and DNA repair. And that's something that we'll be actually touching in the early 2021. And we already have form for submission for study or trial of an ingredient that I've been using since early spring. We usually test on people first, and then me first, then the family, then my friends, and then the dogs. So we make sure the dogs are okay. Anyway, this mitochondrial booster, which is called NMN, has not been really tried in dogs, but we will be doing a trial relatively soon.
Okay.
Is Dana sluggish, or is there any problem with her energy, or?
She's never been, she's been a funny kind of pup. Even from a pup, she never liked to play with dogs much. So she doesn't really, if there's a game that she really likes, she goes all out. But she's a little overweight, and she seems to be obsessed with food. It's like I can never give her enough.
Okay.
So, but other than that, no. So she's never been a dog that goes crazy, even as a pup. So.
So that may be part of the challenge. And, many of our community members still feed processed food because it's more affordable, in quotes, or it's more convenient. But are you feeding processed food?
No, she's been on raw since she was after 1 year, I put her on raw. So she's been on raw for 6 years now. Yeah.
Okay. Is it vegetables and meat and bones, or any carbs?
Very few.
Okay. Yeah. I'm not opposed to carbs completely. I'm just asking. So, there's actually a very easy answer. We have something which is called dog food recipe maker. And I will actually show it to you just a second.
Okay.
Dog recipe maker. And it actually has a little guideline how much to feed.
Yeah, I know. She will lie in front of the fridge and whine for food.
That's so hard. It's
really hard. It's really hard.
Let me just look up the recipe maker, because it does have a little chart.
So she gets about a pound of meat a day.
How much does she weigh?
She's right now, she's about 50 pounds. And the vet told me no more than 44 pounds for her. So
not more. The vet told
no more than 44 pounds, but she's 50 pounds now.
There's another way of determining whether her weight is fine. And again,
the picture.
The pictures. Oh, you know everything. I don't even.
I do know that. Yeah.
I'll tell everyone else. Just a second. I'm just kind of going through the steps of the recipe maker. Just a second. I'm just gonna quickly go through the steps. Okay, I'm here. I'm gonna share the screen again. This is fun. So everyone, if you go to recipemaker.peterdobias.com, this is a recipe maker that will help you to formulate balanced diet. It will tell you how much to feed, what not to feed, and so on. But there's also a really good section where you actually figure out the normal or optimal body weight of a dog. So Marion, if you cannot, and I've been calling you Dana, I apologize. I will have to
that's okay. Yeah.
Surprise. If you can feel the ribs and count them, that's the right body weight. If you give her a bath and you cannot see the ribs at all, that's the right thing. If you see the ribs when you give her a bath, that she's too skinny, right? Yeah. So you should be able to count them, but you should not see them. Is she somewhere there in that area, or?
Well, I don't really bath her that much, but I would say I can't really read this, but she's the one beside the normal or that one there.
She's right here.
Yeah,
Okay.
I
Yeah.
just find it really hard to cut back on the food, and I've tried that. She's lost a couple of pounds, but then it comes right back. I only give her one treat, just dried lamb lung, which has 1% fat. I give her the variety of meats. I always check the fat content of the meats, but she just would eat all day if she could. She just loves to eat, I find. So
Mary,
she's part lab. So
she's part
I
lab.
figure she's got that obesity gene. I don't know. But anyway. Okay, well, that's good to know. Pardon?
No, you're actually very, number one, I want to give you compliments because I can see that you're a good student. You're looking after her well. And the only challenge that you have, and I would have too, to resist those sad or googly eyes. And you may want to, sometimes dogs don't really understand what is good for their long-term health and well-being. So you may need to reduce the food by 10% and see how she does. And resist. No matter how much you feed her, she's still gonna be hungry anyway, right? So
yeah, I know. But yeah, okay. All right. Well, thanks very much.
Oh, you're welcome. And let us know. Is she somewhere around? Next time, maybe send us a picture or something. I'd love to see her.
Okay, I'll do that. Yeah, she's on my bed sleeping right now. But
really nice to connect with you, and thank you so much.
Okay, you too. Yeah, thank you very much for giving us this opportunity. So.
Yes, of course. Thank you. Bye-bye.
Bye.
Great. And it was, lovely to hear a little bit more about one of our community members' dogs. The next participant that we're hoping to welcome in from the weight room is Monique, who has a dog named Faith, who is a little Jack Russell Terrier. So Monique, I will admit you from the waiting room.
Great. Thank you.
Excellent.
And we are going to help. Hi, Monique. Hi. How are you doing? So nice to meet you. And we don't have a sound. We don't have sound, but you will just unmute. I'm sure that
a little Jack Russell Terrier. So I will admit you from the room.
We have a little bit of an echo. I think that we need to mute someone else here. No, Monique, you're good. You're good. All good.
Okay.
Unless you have a Facebook on.
I did. I have the Facebook on. So
great. Alicia will let everyone know to turn the Facebook off. Faith. Oh, I can see the cone. Oh my goodness.
Yes.
Oh my goodness.
Weird. Oh, and this is Scout. There's Scout. He's
fine. Oh, Scout. Okay, so I thought that it was Faith. So you have both?
Scout just wanted to say hello.
Oh, okay. I got it.
So Faith is my problem child. She was the one that was on. She's been itchy for years and years. So, I didn't have her allergy tested because I didn't want to put her through that. But she's been on Apoquel pills. She's been on Cytopoint injections, and those all helped. But in the interim, she got an anal gland issue, which then we finally went to a dermatologist, and they said, well, there's a lot of correlation between allergies and anal gland issues. So we started, before I knew all of your loveliness about food and whatnot and supplements, she was on just like an organic dog food, which I thought obviously was like, good. And then realized after seeing all these different doctors that no, I switched her to raw because even the vet diet, which seemed to be worse, just didn't, her issue helped, but in the meantime of being on the medicine, switched both of the dogs to completely raw and cooked food, and wow, first of all, what a humongous, she's 10, he's 11, she's gonna be 11, he's gonna be 12, they act like puppies now. He was almost
yes.
His arthritis was so bad, he is like just jumping around like he's 2. She's been doing better, but like I said, the anal gland issue went away. But now the problem is so they put her on Atopica for the anal gland issue.
Yes.
Once I stopped that, that's when I started having all these issues with her itching. She can't be without her phone for 5 minutes, or her paws, or itching, like her belly, everything. She's got the really red, she had real nice pink skin underneath before. Now it's just like bright red and discolored.
Yes.
So I don't know. And now she has this like nose thing, and she eats the dirt, and I don't know.
Difficult, right? And it must be so frustrating. And once again, you know what I really appreciate, how much you've been trying, and I can see that you've been really trying to look for the answers. And I'm going to just give everyone a summary based on what you've written down here. So she's been on healthy food and supplements, and she had history of itching and allergies, and then she had anal gland issues, and then she was put on Atopica, which is basically cyclosporin, which is a chemotherapy agent in a way, if you haven't known or didn't know. And the problem is not really solving, right? And this is one of the biggest problems, and this is what I mentioned at the beginning, that medicine is in trouble because we often, in the effort of helping, and with all I know that your vet cares, and most vets do care, but we've been kind of misled into the alley of suppressive medication and chemicals, and going against the immune system and blocking all the different possible reactions. But it's almost like if you're driving a car and you step on the gas pedal and have the parking brake on at the same time, right? Like the body is telling you, hey, something is going on, and we don't want to hear it. We close the eyes and we plug the ears, and this is what we are doing, right? In the effort of helping. So you have not done anything wrong. The challenge now will be, and this is what I've seen in practice over and over and over, that whenever you use the suppressive drugs, whether it's Atopica or some other drugs, the body, if it's strong and vital, which we see here, it starts kind of giving us more signals, like the itching initially. Like if you have an itch, like something bites you, that's a signal that there is an inflammation, right? And it goes away. But when we start going against it, it actually becomes the body will get more erratic in the signaling. It will kind of go wild and almost crazy, not the patient, but the body, the immune system. So the things that we need to kind of look at is, how do we wean off her drugs? Because it's actually one of the body. Every time we use these drugs, it becomes more and more difficult and challenging to treat and get reset. I call it the medical kind of death, right? Like if we have a credit card and if we rake it up and don't pay it every month, then it's more difficult to kind of get the debt down because there's interest. And with this medication, it's very similar. Atopica or cyclosporin is actually originally a chemotherapeutic agent that is suppressing the body's reactions. Everyone can look it up, the adverse effects and all that stuff. But weirdly enough, it sometimes can cause these side effects that it's supposed to address. And this is the bizarre part, that some of these drugs that are actually designed to help certain problems, they can actually aggravate them. So my goal today is to kind of give you a quick kind of summary of what you may want to look at and do. She's on raw food and she's on good supplements, so we have looked after that. Have you seen her ever, like, what kind of exercise does she do? Is she active? Does she like to do something repeatedly?
Yeah, she walks every day for half hour to 45 minutes and literally pulls me. Like I can't go fast enough. Like if I was on rollerblades, that would be ideal.
Okay, and do you use a harness or a collar?
I'm a product prodigy here. I have both of your dog beds. I have the chalk leashes. I got the perfect fit harness. So she's got all the best of everything. And yeah, so she doesn't I mean, she has irritation under her shoulders, I think, just from, she pulls me so hard and I try to like keep up with her, but you know, like I say, she's running.
Okay.
But I feel like more than anything, what's happening, and I don't know how long it may take, this is my theory, is that it's all of the drugs coming out of her. It's almost like her body's, like sometimes I think when you stop medications, it all like comes out and then the side effects happen later, because she's been off of Atopica since the beginning of October. So she's had 2.5 solid months of not having any of that medication. So
She's still scratching.
Yeah, if it was just like, okay, now her body's like, whoa, my immune system's totally shocked, and now you're not giving me this medicine, and that's why she's had this like flare up of all of the itching and all of that. So that's kind of my theory is.
You know, partially that is definitely true. But as I said, you know, it can last for weeks and months, and the body may start being really erratic. I think that there is still a really good chance, but it will take not weeks, but it will take probably months. So this is, you know, if you have a dog that is a puller, I'll just go to simpler things. Because there is the parasympathetic and nervous system and sympathetic nervous system going through the neck, and she has a history of that, I would recommend making sure that I would recommend seeing a chiropractor, making sure that the neck is aligned, because neck misalignment and cervical spine misalignment can send the whole body in a real tailspin. So you will need to find a good physical therapist or chiropractor to adjust to see. Itching on the body sometimes may mean spinal misalignment, blockage to the energy channels to the particular segments as well. I have one little chart that I can share with you just a second.
Yeah, I actually got her an appointment with I finally found a holistic vet out here that's reputable, and not like a lot of them, you get horrible reviews. So it's really hard to find a good one. But she has an appointment in 2 weeks. So I'm hopeful, and they do chiropractic work too. So.
That's great. I have just opened that little chart here, and you can see that you know, the spinal energy flow, it goes from the head to the tail, and the spinal segments send energy to the particular, and blood flow and nerve flow to a particular segments of the skin and muscles and the organs. So if you look here, let's say if a dog has armpit redness or scratching and itching around the feet, something is going on with the lower neck, right? And so on and so on. So that's super important to remember. You know, there's kind of a fine balance. I would start with that, and then I would also focus on digestion. I also would encourage you to register for our trial of the NMN, because the body, when it's so altered by the drugs and medication, it can be even a week of those meds, and it can really alter them. I would recommend you registering for the MNN trial because that will reset the body. MNM, which is nicotinamide mononucleotide, and it's a substance that I have been trying and testing myself and with my family, and we'll be doing trial with dogs and then double-blinded study later on. So Alicia will make a note, and we'll try to bring you on that as well. Not an easy situation, just because there is so much there. But you know, the most important part: keep her comfortable. Put a T-shirt on or something like that if you don't want to put the cone on. Focus on digestion. She'll eat her paws. If she's chewing on her front paws, I'm quite certain that the primary focus, at least in the first step, would be on the neck. And then maybe secondary focus would be on digestion, and obviously overall making her comfortable. But if she's okay with the cone, and if she has still good quality of life, I can see that she has good beds and good harnesses, good leashes, and all that. It's so nice to connect with you. I'd suggest that, you know, keep us posted, let us know, send us an email, see how things are going, and I'll do my best to help whenever I can. Okay.
I think real quick, I just got the liver tuned. Do you think I should start her on that to see if that can help detox her more?
Absolutely, for several reasons. Not only it helps the body to detox and flush, it also has ashwagandha, which is a little calming, and it's mellowing. So, if there's any anxiety, I have not seen any side effects. I actually use it for Pax when we fly, and he usually sleeps through the flight really beautifully. And before, he was a little anxious, so that will reduce the anxiety as well. And I definitely, that would be a good thing to do. Pax is just on cleanse right now on liver tune because he went through surgery last month, and I'm on it too. So that's something that we both are doing for the month of December before Christmas, before we ruin it all.
Well, thank you very much. I'll keep
You're welcome. Give the mic for me. I can't even tell you how much I enjoy doing this. It's so cool. It's so fun. Thank you.
Yeah,
Thank you for coming on. Bye-bye. Good luck. Alicia, who do we have here?
Thank you. I believe the next dog lover that's going to be joining us is Peggy, last name Adams. Her dog is Madison. So
Yeah.
let me see if we can admit her in.
And I will, great. Everyone is skilled at Zoom now. I love it.
People are getting used to it. It's definitely the year that this platform has become a lot more familiar to people, for sure. It looks like the audio is still connecting, so hopefully it just kicks in a moment or two.
What I'm going to do in the meantime, while we are waiting for Peggy and Madison. So Peggy is living with Madison, and Madison is 12-year-old female border collie. And border collies have a lot of different challenges because they're so active, and they can have challenges resulting from that, I guess. Peggy's on raw diet and getting some oils and seaweed products to help her teeth, getting omegas. And Peggy's asking why is Madison eating dirt? And she's asking whether it is because of digestion or what's wrong. So based on what I'm seeing here, and we are still waiting for, they're still connecting, unfortunately. So I'll just answer anyway, and they may be able to ask otherwise. So I can see that Madison is on raw diet. She's getting some omega oils and seaweed product. And the first thing that comes to mind is that, in the world that we live in, food on its own may not be enough. And that's what I've learned with many of my patients, that in the agriculture age, when we have overused and abused soils, the nutrients don't get replenished back to the soil. If you get produce, it usually comes from a different place, and the compost doesn't go back to the field. So as we overuse and abuse soils, it becomes more and more depleted, and our food becomes more depleted, and then we are missing some trace minerals and elements. This was the primary reason why I came up with Greenman, the mineral support that I've been recommending, and I've been using myself and using for Pax. Providing minerals is so essential, and sometimes dogs may eat soil if they're missing something because they're trying to supplement their diet. Now, if Madison is getting minerals and vitamins, I don't see that in the little record here. But if she's getting minerals and vitamins, maybe you want to do a hierarchy test to see where the levels are. Maybe there is some sort of deficiency. So that's the first reason why dogs eat salt. Second, and I noticed that with Pax again, when dogs go through some sort of digestive upset or disturbance or antibiotic treatment, which Pax had to get because he had an abdominal surgery and it didn't go really well, he was on antibiotics, and I saw after that he started eating soil for some time. And I was giving him his probiotics, but he was still eating soil, and I let him because I kind of felt that it was his way of correcting his intestinal flora and readjusting it after the antibiotic use. And it may take a month or two before the flora actually regenerates. Even with probiotics, it will not be the same what it was before. So number one, possible mineral deficiencies. If you're giving any supplements, vitamins, and your dog is still eating soil, check a hierarchy test and make sure there's nothing missing or there's no toxicity. Number two, make sure that your dog gets probiotics. And number three, and that's actually super important too, ideally feed raw food or cooked food, use the recipe maker. And number four, where are all these numbers here? Make sure that you don't feed processed food of any kind. So that's pretty much the summary. There may be some other issues around choosing the right types of meat, warming and heating, depending whether your dog gets hot or cold. You can go to the recipe maker, and I will go back to that little screen to show you where to find it, so you can make a note. Screen share, 1, 2, 3. I'm getting faster at this too. So it's recipe maker at peterdobias.com. You can basically just go through different ingredients and look at what they're good for, and which meats are heating and cooling and all that. You can see that mackerel, for example, we don't recommend it because it contains high mercury. We've worked on this really a lot, and it makes me happy that it's free and I can give it to you. You know, the reason why I'm doing this is, number one, I exited the clinical practice because I felt I needed to share more and help more dogs than 20 a day or something like that. Number two, I feel that health knowledge should be actually public domain, that it should not be charged for ideally. I know that in veterinary clinics, it cannot be done because they're expensive to run, but I have developed a system where I can do that and write and teach and give you tools that can be helpful. So anyway, Mark, Peggy, I'm so sad that we didn't get a chance to hear you. Maybe it sounds like you're muted now. We cannot see you on the video, but do you want to unmute and at least say hi and see if you have any questions? It looks like it's not possible. Anyway, I hope I answered it in the best way I could, and we'll go to the next person.
Excellent. So the next person is Bonnie, and Bonnie has a mixed breed dog called Mila. So let's see if we can get Bonnie in from the waiting room.
Bonnie and Mila. Let me just see if I can find Bonnie and Mila. I got Mila. Bonnie, you can unmute yourself. You're here. You're live. Oh, still muted. There's a little mute button in the lower left corner.
There we go.
Hi, Bonnie.
Hello.
Really nice to see you here. Mila is somewhere around with you?
Yes, as a matter of fact.
If we can meet her, that would be fun. Hi, Mila. Oh my goodness, look at that face. Oh, I'm sure that you have a lot of pictures.
I don't, because I'm not much of a picture taker.
I see. Well, I'm going to encourage you to take, because she's so cute. She is so cute. Anyway, I understand that you have some questions about allergies to chicken.
Yes.
Which manifest by just itching. Where does she itch?
Mostly on her back and her ears. Along her back and her sides.
And what kind of chicken does she get? So is it cooked chicken or raw chicken when she gets it?
I don't feed her chicken, period, now.
Okay.
But, I live in Mexico, in the Yucatan, and the availability of high quality dog food is, we do have Petco here, so there is some good stuff on the shelves. But I read labels quite carefully, and most of the dog foods do contain chicken in some shape, fashion, or form.
So you feed her homemade diet then? You feed her raw diet?
I've been trying to convert all the dogs and the cats to a homemade diet, but it's been a challenge in itself, because really when you buy, you can actually get organic chicken more than you can get organic beef. Mostly you get grain-fed cattle, grain-fed, or at least whatever they feed pigs in this country. Not very much grass-fed. So it's very, very difficult to find good organic meat.
So Bonnie, the first thing I would like to say, I can see that you look after. How many dogs do you have, by the way?
4.
4. Good family. There were 4 of us too. I think it's a good number. Always some sort of entertainment and fun. Anyway, you live in a hot climate. Do you think your dogs are generally more hot and seek cold, or vice versa? And how is Mila?
They usually, let me think about this. Mila usually seeks cold, whereas the other 3 dogs will lie out in the sun on the cement in the heat of the day.
It makes complete sense that she actually doesn't do well on chicken, and I'll tell you why. Because chicken is and birds and poultry is actually warming meat, and if you feed it to a dog that is actually hot, it can aggravate and irritate their system. So I think that, you know, in this kind of situation, you can give the meats that are more neutral or cooling, like beef or lamb. Duck is actually cooling as well, if you have access to that, and try. But I would not really force the issue, and I would basically just not feed poultry, because, you know, even in Chinese medicine and traditional Chinese medicine, they say that heating meats to a hot dog is actually, or a person, is probably not a good idea. The other thing that I would do is to make sure, so if the symptoms appear, like you say that she scratches around her back, along her back, right? Or itches.
Along her back, along each side of her lower hip area, more so her upper back and her ears.
Whenever I have ear issues, and we have, Alicia, if you can send me the link to the blog for ear issues, that would be great. Or show the little chart, Alicia, if you do have, but I think I have a screen share. So you can you screen share, Alicia? Maybe.
Yeah, I should be able to. I'll just pull up the chat. Okay.
Anyway, what I wanted to say is when the back is itchy, and the ears are itchy, there are a few things that may be going on. Generally, they are more likely to get inflamed because they have been somehow compromised or injured or tight, right? So if you feed the chicken, the body is in a little bit more of an inflammatory state. And the first thing that will happen, it'll go to these areas that are compromised. So backbone, sometimes I would recommend, if you do have any physical therapists or chiropractors, but you're living in Mexico, maybe not, using a Zoom Groom, which is a nice massage brush, rubber massage brush, is really good along the spine. When it comes to the ears usually, the 3 main reasons, actually, that is not the one, Alicia, but I'm going to, that's okay. Well, we'll have, I may be able to find that chart in a moment. It's like an infographics from Julia that we created. It will be an infographics in assets. I'm giving Alicia these navigation pathways here. Anyway, so ears, neck, liver, digestive tract, right? So the first thing that, because you're kind of in a situation that may be a little challenging sourcing the food. If you have one dog that appears to be a little more compromised on the ear level, I would definitely try to switch Mila to cooked diet. And living in Mexico may be a little safer to do cooked than raw. And giving her the cooling meats and adding some probiotics. And the overall supplements. Sometimes just giving omegas and probiotics and minerals and vitamins will just solve all the other problems, right? And sometimes it doesn't, but it's kind of like we have to build a good foundation for everything.
course.
So going back to the ears, neck, massaging the neck, making sure that if she goes out, that she has a harness as opposed to a collar.
Right.
Liver, you can do liver cleanse once every 6 months to make sure that her body will settle down and get rid of toxins. Probiotics and good food for the digestion. And if the budget allows, giving the fabulous 4 overall, the essentials, then you kind of know that you offer the body the smorgasbord of nutrients and that you looked after the basics. But my sense is I wouldn't really be pushing the chicken. It's unfortunate that that's the most available food. But, sometimes the genetics are such that we cannot really go against nature and against the body.
True.
It makes sense. Do you have any questions? I talked for a little bit, so I just would like to make sure that I answered everything, or if you have anything else that you want.
What can I do for, like, her left ear is extremely, it's sore. The right ear I can clean a bit, but the left ear, she just won't let me touch it inside.
I am so glad you're asking that, because we have a really comprehensive article about what to do with ears.
I've just pulled it up. I can screen share it, and I am on the infographic. I'm not sure how well that will do on screen share with it being small, but we can include a link in the chat to make sure everyone can get to the article.
So I'm just going to go into a little bit of detail here because it's a good opportunity. In the conventional medicine understanding, there's bacteria and yeast and maybe hormonal conditions and ear mites. In integrative or holistic way of seeing ears, it's usually digestive tract and overuse of medication or processed food, sometimes excessive cleaning, and sometimes neck injuries. So then you can see the different types of ear conditions, and it has a description below. So you can actually go to the chart when we'll send it to you. And for everyone else, you can just search for Peter Dobias ear problems or ear infections. It'll come up. And then it goes, Alicia, if you can scroll down a little bit. Then it goes through the conventional treatments and then natural drug-free approach. And I've had really good results with ears, even in dogs that I would think are beyond point of repair, and they did relatively well, and some of them extremely well. It really depends how much ear medication we use. So if you read the article, it'll be all there. Unfortunately, I cannot tell you everything, but call us back or email us, and I think that Mila is good. She's so sweet. I feel like giving her a hug here. Hey guys, isn't she cute? Oh my goodness.
Peter. There you go. He's shy.
Have a wonderful day in Mexico, and thank you for coming on. It's pleasure. It's been a pleasure.
Thank you very much for your time. And
you're welcome.
You as well, Alicia.
You're welcome. Thank you so much.
Alicia always does well, I must say. Okay.
Thank you. And I think we've spoken to 4 dog lovers so far. Would you like to take maybe a sample of questions that people have posted in comments? I can jump to that. Okay.
Why don't we just do that? That sounds like a plan.
Okay. So we have 3 questions that I've found while we've been on the Facebook Live. One of them is from Debbie. Debbie has a 1.5-year-old Frenchie that she adopted. Her ears, she's scratching the fur off the back. So this question might relate back to what we were discussing with Bonnie. She has been to a vet. They have a clean, like an ear clean solution that they're using inside of the ears, but the ears are becoming quite dry with a light crust versus, I guess, being quite weepy. Is there any additional information other than what you've just mentioned to Bonnie about ear care that you could share with Debbie?
I would say that this is actually, whether it's dry, crusty ear or whether it's moist ear, the approach is very similar. Sometimes I see the dry ear, the kind of scaly ear, a result of over cleaning or too much scratching. So you may want to put collar on to prevent scratching. I used inflatable collar for Pax when he went through his surgery. It's called MyDog, MIDOG. pax.com, and it's wonderful. I really liked it. It was I could inflate it partially, and Pax slept on it quite nicely. It was like a pillow for him. He didn't seem to be really upset about wearing it during the surgery recovery. Preventing scratching, making sure that you actually don't over clean the ears. That's one of the mistakes that people make. They think that they can actually clean the ear problem out. It's almost like washing the car when the oil is leaking. It's not really working well. And the ears are just almost like a signal light, the blinker that there's something else going on, the emergency light that goes on when there's digestive issues, neck issues, and liver imbalance. So, try to read the article, and if you have any more questions, let us know.
Absolutely. And we will make sure that we post a link to the article in the Facebook chat. Lots of people contact us about their dogs having challenges with ears. So hopefully this information will be really helpful to everyone. The next question, next question is from Stephanie. Hi, Stephanie. The question is Pax on anything else besides Livertune to help detox after his surgery? One of her dogs, Tilly, has been on Livertune since she had her recent spay surgery.
Just for everyone else, Pax went through an abdominal surgery because he had a retained testicle, little monkey. He didn't let it go. So he did have some complications. There is a little blog on it. So if you wanted to read more details on my website on the blog, you can. The one thing that I noticed that his body, because it has not been suppressed with medication and drugs or anything, he really reacted strongly to the trauma of the surgery because they had to explore the groin, and he had quite severe reaction. But then within days, like, he went back to normal, almost like as fast as he went up, he went down, and that's a good sign. I didn't give him anything else than his regular essentials, the Fabulous 4. Increased doses of omega. I tripled or quadrupled the doses of omega for the healing period. And I also introduced him on Livertune when things were done, and obviously doubled the dose of probiotics after he finished his antibiotic course, because he had to be on antibiotics. We didn't know whether he had an infection. His tummy was open, and I didn't want to take a chance that there would be some sort of problem. So, sometimes you have to kind of take compromise. You have to take the route, what I call the route of least regret, where you have to make a decision that you would regret the least. So again, Livertune is absolutely fine. Livertune is a fermented product that is supporting the liver, helping a detox, calming the body, calming the system. It's like a little flush, little rinse, little shower for the liver and the body. And after surgery, definitely very useful and helpful. Pax is, oh my goodness, he's, I've taken some videos and pictures. He's a force. Like, I really can't believe that he's 2 weeks after surgery only, because if you see some of the videos on Facebook, he's crazy. He's like, he is fast. So I'm super happy. It doesn't feel like he was affected in any way, even though he was very dramatic. So don't worry if the reaction is a little more severe. Just make sure that you work with your vet, do a cleanse, provide probiotics, and things should be back to normal.
Awesome, thank you. And the last question we have for today's Facebook Live is from Rosemary. Rosemary's question is to do with mouth health. Her dog has inflamed gums on the upper side of her mouth, just on one side, not on both. I know that we have a lot of resources which we can share and post in the comments to help Rosemary along with dental health articles and such. But is there anything that you would let her know to look for, or just to work with her vet about the inflamed gums on one side of the mouth in the upper region?
So when there's gum inflammation and it's one-sided or located in a certain spot, you really want to make sure that there is no infection or maybe tooth abscess, or a growth is a possibility, less likely but possible. You definitely want to get an exam. If the dental health and there's no tartar, and if everything looks good and tooth is not fractured, there's no abscess, there's no growth, and so on, then once again, like, you will probably have to work with your veterinarian, because I would need to see the gum. I would need to really see the appearance and so on. It's very unusual that you would have it just on one side. Sometimes it happens where if your dog is, let's say, sore, tooth is sore, he or she is not chewing in that on that side, and it becomes inflamed. There's more tartar. There can be fractures. Sometimes dogs chew on large marrow bones, which I do not recommend, and they break their teeth. I recommend medium-sized to smaller bones. Alicia will post, or one of our team members will post a link to bone article. But generally, it requires an exam. Some of these problems really must be carefully looked at before we give a recommendation. That's the limitation of online work, but I hope otherwise you've enjoyed the session. I enjoyed it very much. Thank you, Alicia, for being here. If you would like to join our community, you can go on peterdobias.com and join us, because I send a lot of materials and articles and blogs, and we'd love to have you. If you would like to check our website, you can go to peterdobias.com and look over whatever you wish, articles, learning courses, products, whatever there is, leashes, harnesses. It's Christmas, so maybe you want to give your dog the safety of a good, gentle walk and leash. Anyway, thank you so much. Have a wonderful day. Happy holidays. We will be back probably after the Christmas holidays, but this is really enjoyable. Take care.
See you in early 2021.
Bye-bye.
Bye.